right, let's get started. Thanks everybody for joining. Today we're going to be talking about how Providence Swedish runs peer leader hiring to transform nurse recruitment, among many other topics related to nurse hiring and nurse retention too. All right, so my name is Iman Abu Zaid. I'm an MD by background, and I'm the CEO and co-founder of Incredible Health, which is the leading and fastest growing marketplace for permanent healthcare workers. Incredible Health is the only platform that enables hospitals to hire permanent experienced nurses in less than 20 days. And we flip the script where the employers in the hospitals are applying to the nurses instead of waiting for the nurses to apply to them. Joining us today are two remarkable leaders who we're really excited to do a webinar with. First is Suzie Scott. She is Chief Nursing Officer of Providence Swedish, South Puget Sound. Suzie has been at Providence since January of 2020. She's led her team through challenges of the COVID-19 pandemic and nurse staffing challenges. She brings over 30 years of experience as an Army Nurse Corps officer as well. And then we also have Dana Johnson, who's a Chief Human Resources Officer of Providence Swedish, South Puget Sound. Dana has over 25 years of experience in human resources management and operations management too. So Providence Swedish has served the Puget Sound region since the first Providence hospital opened in Seattle in 1877, and the first Swedish hospital opened in 1910. These two organizations became affiliated in 2012, and in 2022, they comprise the largest healthcare delivery system in Western Washington with 22,000 caregivers, 8 hospitals, and 244 clinics. So Suzie and Dana, thank you so much for joining us today.
Thank you. It's a pleasure to be here.
All right, just a reminder to the audience, this is designed to be an interactive discussion. Please ask questions in the chat. We are going to answer them as we go along, and there's also time at the end dedicated for questions and answers too. And then this webinar is recorded, and we will be sharing it with everyone as well. So today we're going to be covering a few topics. First is the state of the nurse labor market. We're going to be hearing more about the peer leader hiring program at Providence Swedish. We're going to be discussing a variety of nurse hiring initiatives, nurse retention initiatives, how Incredible Health can help, and then we'll be doing some Q&A as well. All right, so let's get started. So let's start with a market overview, just so we can set the stage here. What is happening in 2023 with nurses in the U.S.? We are in a state of continue to be in a state of a shortage. So our demand for healthcare as a country continues to increase because our population is aging and there's more and more patients and more demand on the healthcare system. However, we as a country, we haven't done a great job of increasing the number of healthcare workers to meet that growing demand. So as a result, we do have a shortage. Healthcare is the biggest labor sector in the country by number of workers. It's been the biggest since 2018. 1 in 8 Americans works in healthcare. So then the problem nationally is, projected to keep getting worse. We're on track to be 1 million nurses short by 2030. The average annual acute care nurse turnover is at 22.5% nationally. That has gotten actually a little bit better since the COVID-19 pandemic, but it still remains relatively high. We're also seeing labor as a percentage of revenue continue to increase. It's at 48% for publicly traded hospitals. However, so what this means is that labor costs continue to rise. And it's not just the temporary labor costs or the premium or travel labor costs, but even the wages of permanent labor and permanent nurses continues to increase because there's more and more demand for that labor. And then finally, the days to hire is at 95 days is the national average right now to hire a permanent specialized nurse in an acute care role. We have some health systems that we work with that are lower than that, some that are higher, but the national average right now is at 95 days. So that's a little bit about what's happening nationally. The other piece of data that we wanted to make sure we share is why is the turnover so high, and what is it that nurses want today? So when nurses are creating their profile on Incredible Health, and we have over 800,000 nurses on the Incredible Health platform, and when they are creating their profiles, we ask them, why is it that you're considering leaving your role? And so one of the top reason that's often selected is, I want to advance my career. Okay, so that can mean expanding their skills within a specialty. That can mean cross-training. That can mean a new graduate nurse looking to specialize further. It could also mean a nurse, wanting to go into leadership. So something to do with advancing their careers and expanding their skills. The second most common reason is they want a more flexible schedule, and better balance. And so, the days of 12-hour shifts, full-time only, 3 days a week, are kind of over. And now nurses want a variety of options. They want part-time options and 8-hour shifts and 4-hour shifts, and they want more flexibility. And they are willing to look for other employers that will give them that flexibility. The third is something to do with geography, right? They want to reduce their commute time, or they're looking to relocate. There's quite a lot of movement in the permanent nurse labor market. We see on our platform that over almost 40% of the nurses hired on the platform are relocating from a different geography. And so they are moving for work as well. And then finally, just something to do with compensation, looking for better wages or better perks and benefits too. But it is in that order. We work with over 800 hospitals now across the country. We work with many nursing and HR leaders who focus a lot on number 4, but there's a lot of opportunity in number 1 and 2 that if we can address, we can improve retention and improve hiring too. All right. We also do a survey and a study of nurses too. And this is our most recent one from earlier this year. What are the top concerns that nurses have just in general? 73% in our most recent study are concerned about the shortages. 70% are worried about burnout. 68% are saying that salary and benefits continues to remain a concern. 45% say they're concerned about their work environment and safety in their work environment. 30% say they still have concerns about their scheduling and their work schedules. And then 25% are concerned about the limited career advancement. And so just in general, these are all factors that do impact retention as well. All right, so let's turn to our speakers now who are in the middle of this, in the thick of what I've just discussed. And so Suzie or Dana, could you please just provide just an overview of the changes that you've seen at your organization when it comes to your nursing workforce in the last few years?
Sure, I'll get us started with that one. In recent years, we've seen some significant shifts in our caregivers' perspectives, especially in the context of the pandemic. And you noted that on the slides you just presented. Our nursing workforce is not just worried about salaries and compensation, they're worried about staffing and the work environment that they're joining. The salary and benefits are certainly part of it, as you demonstrated, but it's bigger than that. And these challenges and the changes that are in the workforce have really prompted us to adapt our hiring process to meet those concerns and have quicker response times. So as a result, in 2023, because of the efforts that we were putting forward and not just focusing on salaries, we've seen improvements in our ability to hire new caregivers, particularly with our registered nurses and certified nursing assistants.
Great. And then Dana, how about from an HR perspective? What have you seen in the last few years as far as the nursing workforce goes?
Oh, from an HR perspective, we've done substantial adaptations to evolve to that workforce need. Our introduction with this program that we're talking about today is just one of the facets that we have tried to incorporate to make not only our core leaders' lives a little easier, but our caregivers as they enter our organization. With this approach, we've been able to meet the candidate where they're at, find a fit for both them and the organization at the same time. It's allowed us to be more responsive to our candidates and ultimately reducing our time to fill, which we'll talk about a little bit later.
Okay. So let's talk about this sort of initiative, the peer leader hiring program that you're implementing. I guess Suzie, can you give us just strategically why were you even sort of considering this this option to pursue?
Well, sure. If all of our managers are focusing their time on filling vacancies, then that takes away time for them to spend on the caregivers that are on their floors working. We recognize that we could free up time for our nurse managers to focus on their current workforce and really gain some efficiencies in the hiring process itself by dedicating one nurse manager to peer leader hiring. So we have one registered nurse that was selected from among her peers to do all the interviews and all the selections for our entire acute care nursing workforce. So that's registered nurses, licensed practical nurses, our certified nursing assistants, and even our emergency department technicians. She's able to work a lot faster, and at the same time, she can spend dedicated time with candidates, talking to them about the benefits of working with Providence. And then if the candidates are eligible or applying for more than one position, we're able to interview them one time for multiple positions and find the best fit for both the candidate and for our hospitals.
All right, so that you just reduce the number of cooks in the kitchen, basically.
Absolutely.
to just one. Great. And then Suzie, would you mind Dana, would you mind sharing just the sort of the details or mechanics of the program? So you have one hiring manager. What else did your team sort of put in place to make this work?
What we put in place to make it work was a significant change management process that's led by Suzie, and looked at our technology and how to embrace that technology to make it work for this experience that we want. Our technology, we tend to be a little heavy on that and wanted to create a more of a personalized experience. And so addressing that person-to-person approach was a great way to go. Initial resistance, yes, we did receive that from our managers who are used to hiring for fit for their unit. And so it did take a while for them to come along and really embrace this change and realize not only the time savings for them, but for the candidate. And so we were really, really fortunate to have that great change management process led by Suzie that would help us get to the place we are today.
Okay, so let's dig into this topic like a little bit more, right? So when we're, I mentioned earlier, we work with over 800 hospitals and health systems across the country. And this tactic, or what is actually a best practice of just please simply reduce the number of hiring managers, often, almost always faces resistance, right? And it's usually from the other hiring managers, and it's almost from the emotional aspect of it is not wanting to give up control. So what tactics did you put in place to encourage the other hiring managers to adopt this? Was it conversations you had to have one-on-one? Was it data that you had to share? Sort of like walk us through the details, because many leaders here, and I can see there's multiple on the phone from other organizations as well, who are both HR and nursing leaders, are trying to tackle the same thing.
Yeah, I'll get started and then turn it over to Dana. It was really all of the above. We started, and we absolutely had the resistance. Nurse managers was, hey, this is my responsibility. These are the folks that are going to be working on my units. And I want to be responsible and in charge of hiring that. So we started with a lot of communication and data on where we thought we would go with this. And then after selecting our peer leader hiring manager, she met with every nurse manager individually, talked to them about the behaviors and attitudes and aptitudes that they were looking for their unit specifically, asked them about specific interview questions that they would be asking and the desired responses that they were looking for. And then that's what she uses to conduct the interviews for the caregivers that we're hiring. So she's really just being a substitute for the nurse manager that would otherwise be asking those questions. Okay. And then Dana, from your perspective, what else have we looked at with this?
A partnership with our talent acquisition team was really critical. Is forming that balance with the peer leader and our partners in talent acquisition was really critical for the success. I would say also finding champions. We knew that there were some resistors out there, but we also had some champions that really understood what we were trying to accomplish and they embraced it. And then that peer-to-peer kind of discussion really helped us move that needle along as well. But I will say the partnership within the talent acquisition world to really adapt to our needs, to funnel those candidates, was a really big lift for all parties to look at how that automation is put into place, and then that trust that we built between the partnership within the nurse leaders and the talent acquisition team.
Yeah,
One more. Go ahead, Suzie. Yeah.
I'd just like to reemphasize that has been the most critical piece, is that partnership. And it starts at the executive level.
Yeah.
But this would not have been successful if our peer leader hiring manager did not have a good, strong partnership with their HR counterpart and having that dialogue. So we've gained some efficiencies on that side too. So when instead of having 20 managers calling a hiring manager, or an HR business partner, we've now got one. And so they're able to coordinate and prioritize in a much more effective manner to be able to work through any of the barriers with the technology for our candidates coming in, and really reduce that burden on both the candidate and our internal team.
Absolutely. Suzie, specific question. How did you overcome the challenge of the fact that the hiring manager that was selected is hiring on behalf of multiple units or multiple specialties, right? Like, the OR nurse, the med surg nurse, the critical ICU nurse, they're all, slightly different. So how did that one hiring manager accommodate so many different specialties?
It really started with those initial conversations between each of the managers and our peer leader hiring manager to be able to understand their clinical practice environment, and understand the behaviors and the skills that they were looking for in the candidates that they would have otherwise hired themselves. And then it was really just proof through the concept of doing it. We asked our leaders to put some faith and trust in us as we piloted this. And then as we showed them the data and looked at our returns and showed them how we were reducing that time to hire and increasing the volume of caregivers that were coming to them and then staying, I think that's really what convinced our folks that this was working, was demonstrating that it did work.
Okay, great. So can you share with us just sort of the detailed results or outcomes of this program?
Sure. Dana, did you want to start with that, or would you like me to?
No, you go, Suzie.
Got it. So as a result of the efforts so far, we've actually recognized almost an 80% improvement in our, we've got a 78.8% offer acceptance rate. So significant improvement in the candidates who are saying yes to us. And we've also seen a 10-day reduction in our hiring timeline. And, for candidates that have a choice, that makes a difference. That hospital that's first to make the offer for the job, when everything else is equal, that's significant.
Absolutely. I mean, just to put what Suzie just mentioned in context, you mentioned a 78 or 79% offer accept rate. The market average for offer accept rates is closer to 60%. So the fact that we're doing 20% better than average is phenomenal, and that is a tremendous increase in offer accept rates. And then on the speed topic, you accelerating it you reduce the time by 10 days. We operate in many markets, and we see that in every single market that we operate, it's actually the health system with the fastest hiring speed that hires the most, then even more than the health system with the highest salaries, even more than the health system with the biggest brand. And it is for the reasons you just mentioned, Suzie. It is a highly competitive market. Speed is like the top factor. We also see on our platform that 61% of nurses accept the very first offer they receive. Nurses are often working full-time. I mean, honestly, working overtime while they're doing their job search. So they do prefer employers that are not wasting their time and moving them through quickly. And so it also creates a very strong perception of Providence Swedish when the nurse is able to go through so quickly. And it's almost like it's like the first impression, right? So and we've interviewed quite a few nurses, and they say, hey, if the hiring process was so fast and so efficient, maybe the rest of the health system is operating really well too. They make that sort of inference. So that's been phenomenal results. So I wanted to chat a little bit more about the partnership between talent acquisition and nursing, because both of you made the point about how important that partnership is. It does start at the most senior levels and all the way down. Sort of what did you both do to overall improve the relationship and the working relationship between those two teams, so those two teams can operate better?
Suzie, you want me to take this one?
Yes, please.
I would say communication. I think before we relied too much on our IM system, emails. This program really brought us to a place where we were having conversations, not text, not emails, and really opening up that dialogue about what our needs are and our concerns are. And so our talent team was really innovative on, hey, this is an idea we should roll out. Let's do this. And looking at how we have the conversations versus using the technology. And one of the things that we really implemented that I wanted to kind of put a fine point on is that person to person is what we called the closer. And I say that in a funny term, but what we did is once that peer leader said, I want to hire this person, we really had someone come in, follow up with that candidate, ask the conversation or ask the questions, have a conversation about what they're really looking for. Because what we're finding is a lot of people were going with an offer, and the offer doesn't tell the whole story. It doesn't tell the story about benefits. It doesn't tell the story about retirement. It doesn't talk about culture. And so really following up with those candidates, and maybe even those that were on the fence, to say, this is why you should choose us. And I think that was a critical part on capturing those people who may be teetering with a couple offers and one's 50 cents more. It's not about the 50 cents. It's about what work experience you're going to have on a day-to-day basis and your total compensation or your total rewards. And so implementing that as a partner to our peer leader was a critical part to our success.
Okay, fantastic. Now, recruitment is just the beginning of retention, right? And so what's, Suzie, if you don't mind sharing, what insights, did you see any retention improvements? You sort of mentioned that, but can you unpack that for us a little bit?
Sure. Sorry, I got lost in my words there and the thoughts. As we mentioned, our nurse managers have a significant burden in trying to manage both bringing in a workforce and supporting the team that's there. And what we recognized really quickly was that with nurse managers having additional time, they could really dedicate that extra time to focusing on the team that's here in-house. Because we wanted to spend as much time on retention as we were on recruiting. So, our nurses were telling us that they're burned out. They were telling us that they were mission focused and had a strong desire to continue to serve our community, but sometimes they just needed a minute to breathe and decompress. So we really started to focus on internal efforts to be able to support our team that's here working, and how can we manage and assist them with their burnout, with their fatigue, and just help them keep focused on that work as they wanted to, but also focused on themselves. So we did some internal work on things like creating Zen dance, that momentary retreat opportunity for them if they've got a couple of minutes and just want to relax. We focused on what was important to them on the units and increased our rounding and our presence. And we brought coffee carts with us so that if they couldn't get away for a minute to get a cup of coffee or a snack, we brought it to them, and just focused on what they wanted and needed in the moment at the time.
And then, Dana, would you mind sharing? So let's say that you have peers across the country who want to implement a program like this. What are your like sort of top pieces of advice or tips for how to do this well?
I would say first and foremost, the buy-in at the CNO level. Having that person, your champion, it was the critical, I guess, success for us. Suzie is an inspirational leader, and when you have those inspirational leaders, people will follow. And so she really championed that work and really talked to them about what benefits they will see from this, and made it about them as well as the candidate. And so that was really made this program successful from the very start. Finding those champions, like I said before, I think that was really important for us to find those shining stars that really helped us along the way. And then finding the right nurse leader. Finding that person who is well-rounded, knowledgeable, understands the scope of their job, and really is a true partner to that core leader. This person that we blessedly hired has just been a shining star for us in terms of her ability to partner and network with those core leaders to build the trust on who she's hiring. She feels a deep sense of purpose to do it, and ownership over finding the right people. And that's a lot of pressure to hire someone for another department. And so finding that right nurse leader is really critical.
And if I could jump in and add, having that critical partnership with that HR team member is also crucial. You have to have the right HR team with buy-in and willingness to jump in and do things. Dana mentioned the closer. That's the HR member of our team locally on the ground. And it's that daily dialogue, sometimes hourly, minute by minute dialogue about what's going on with the candidates and where we need to focus our efforts, who's getting interviewed, who's ready for an offer, who's got an offer. That partnership is so crucial in the success of this. You know, I noted one of the questions in the chat was, does the peer leader hiring manager do initial application reviews, or does the transition assistance team do that? And it's yes to both. It's that daily dialogue back and forth about who's in the queue, what their application looks like, who's the priority, and where we're at. And then once the interview is done, circling back, who do we need to really focus on from a closer perspective to be able to move those forward with that. So there was a couple more questions. The closer is the separate HR role in there, and then our interviews currently are all virtual, so all online. So
great. Another question that came in is like, what challenges are you seeing? Do you see or are you expecting as you're growing and expanding this program?
Do you want to start, Dana, or would you like me to?
Why don't you start? I have some ideas. I'll back you up.
All right. We're actually in the process now of expanding this program. We started with our acute care units, so all of our inpatient nursing units, plus the emergency department and our critical care units. Now we're expanding that out into some of our specialty areas. So I think one of the biggest challenges is finding that next. So our current peer leader manager is at capacity. She's fully booked every day. So I think the biggest challenge is going to be finding that next peer leader manager that can adapt to multiple different specialties in some of areas like our OR and some of our unique disciplines like interventional radiology, that nursing support that goes there. What are the specific skill sets that we're looking for in there, and how do you adapt to multiple areas? And then that finding somebody that can do that cross communication with the person that's doing the acute work as well.
Yeah.
It's just,
Go ahead.
so sorry. I want to back Suzie up and say that I would say that is the challenge in finding that right peer leader.
Yep.
For us, we can't really expand quick enough. Honestly, like we would have the capacity to keep expanding, but we just want to be prudent about it and realistic about it with all the other change initiatives that are going on. So the sky's the limit for this for us. It's just finding the right talent to make sure that the partnership remains. I did see one of the questions that popped up is the cadence of meetings. These folks are probably in constant communication. So our peer leader and the closer, aka coordinator, so that's more of a coordinator role. They are in constant communication. They have SharePoints they share with the data. That's live tracking on where the candidates are at. And so they're in constant communication about the numerous candidates and where they are in the process.
That's really been the beauty of technology over the course of the last 3-4 years is their roles are not within the hospital, they're working remotely, but the technology supports that instantaneous communication across the team and that coordination with each other and with the candidates.
Okay. That's fantastic. Thank you so much for sharing all of those details. So I'd love to just chat about hiring nurses overall, and would love to hear a little bit more about what else do you have in place to drive nurse hiring beyond this program?
Sure, thanks. Dana, is it okay if I get started with those questions?
You bet.
We've recognized first that there are a lot of candidates out there for many roles who may not know how to access us to identify what jobs are available, what's out there. Some, particularly for some of the entry-level positions like our surgical techs or our certified nursing assistants, they might not even know exactly what they're looking for in healthcare. So one of the things that we've done is we have focused our efforts on an outreach coordinator who goes out and engages with students, with potential caregivers at our local high schools, at our colleges and universities, at many of our training programs, to be able just to let them know that we're here, and then help facilitate getting into the door and helping through that application process and just communicating what's available and out there. So that has paid dividends with us to be able just to ensure that folks know what's in the realm of possible and then continuing that communication. We've also started back with in-person hiring events. The virtual application is not for everybody. And some need help with the technology. Some just want to have that that face-to-face encounter and see the team and the environment that they're going to be working in. So we've started those as an opportunity as well. Still working with the virtual environment and the applications there as well. In addition to that, we've got a nurse tech program. So our registered nursing students, while they're going through school after they've completed their first semester of clinical rotations, can come work for us and continue to gain skills while they're going to school. We hire them with the flexibility of coming in and working as many or as few hours as they want during their school hours or school days. And that really helps them build the skills. They're able to do just about anything that they've been checked off in their clinical rotations, they can actually perform with us and continue to refine and hone those skills. And then what we found is those nurse techs then apply for positions with us in their residencies following that. We've also started a student nurse assistant program. So certified nursing assistant students, before they even start their program, can come work for us for us. We will then provide tuition assistance to get them through their program, and then do skill building with them while they're getting the didactic education in their CNA program. Those students too then also stay with us, and we just transition them into a CNA job role once they've completed their certification program and have that exam underneath them. And then we've also got a surgical tech training program. If we've got candidates who are interested in the OR, we will bring them in, train them, facilitate coordination through the education process and the certification process, and then transition them into a surgical tech role. Dana, what else would you add to that?
Well, what I would say is these tactics, some are short term and some of these strategic things are really long term, right? We're going for the long game here. And Suzie and I hope that before we retire, we'll be able to see the fruits of our labor and see these student nurse assistant programs, caregivers transitioning through their career into RNs or other roles. And so, our outreach coordinator and our SNAP program and some of the strategic programs we're putting into place, we know it's not a quick fix, but the long game healthcare will be better for us being innovative in getting people in the door and finding what their passion is.
Well, and that's the great thing about Providence is once we get you in the door, we've got so many professional development opportunities available to our caregivers. You mentioned that was one of the number one reasons people are looking for a new job is advancing their career. As soon as you come to Providence, you have the ability to apply for grants and scholarships. We offer continuing education. We offer the ability to move into different clinical positions, different leadership positions throughout our system and throughout our organization. And that's a huge benefit for coming to work with us. And we talk about that on day one for our candidates coming in.
Okay. Great. And so there's already been some impact of these multiple hiring programs that you just described. The number of nurses you've hired has increased?
Excuse me. Yes, we've had about 31% more RNs hired this year than last.
Okay, that's a huge increase. Congratulations. That's awesome.
Thank you.
And then let's spend a little bit of time talking about retention as well. So maybe if one of you could just give us an overview of your retention strategy too for nurses.
Suzie leads most of these, so I need to give her the spotlight.
Dana, I was going to say I've done a lot of the talking today. I was going to turn it to you, but maybe I'll talk about some of the internal tactics that we've used to be able to help with retention, and then turn it back over to you for some of our wellness programs, if that's okay. So we mentioned the Zen Dens earlier and talked about those, that we've got opportunity to be able to help our caregivers just in the moment with that relaxation. So we created those spaces for them where they could sit in a massage chair, experience some aromatherapy, music therapy through an iPad, whatever they need in the moment for a few moments during their day. We also created a We See You campaign, and this was actually the genius of some of our nursing leaders who said, we want to help our caregivers recognize each other. And so Dana and I just said yes. What they created was a Pay It Forward campaign where they facilitated the ability for our units to say thank you to one another. They started by bringing a basket of snacks to one unit to tell them they saw the great work that they were doing. And then they asked that unit, hey, who would you like to recognize? They told the team, wrote a quick note, and then the team made another basket of snacks and took it with that note from the first unit to the second. And they just kept doing this, letting each unit recognize another unit to pay it forward and tell them, hey, we see you and appreciate the work that you're doing. And that was just amazing for the team and really helped folks recognize each other and recognize that need for resilience within each other going forward, and it helped with our retention with them. We talked about the coffee rounds, and we just expanded our leader rounding efforts from what they were to bringing what the staff was asking for was just a quick cup of coffee or a snack, and we opened that up to day and night shifts so that they could have the support that they wanted and needed. We also then coached our leaders. We helped them understand what was needed to be able to help get engaged with their caregivers. So one of the things we did as an example of that was we started a monthly brown bag professional development session for our managers and assistant nurse managers to help them build their skills. We started the first one with a specific book that they chose, and we worked through the chapters and lessons learned on that. We're about to close that out, and we'll start on the this next meeting. We'll just start on the next set of skills that they want to build. But that way they could then talk to each other about the skills and then take that out and apply it in the engagement process with their team. So Dana, what would you add to that?
I would say Suzie and I kind of coined this next year, the year of training.
Okay.
And so for us, what we need to do is refocus our work on the development of our core leaders. Throughout the pandemic, we've realized we've just been in that on fire mode. And it's time for us to really sit back and educate our core leaders on what they're really here to do. And I think that's been a challenge for people, is we've forgotten what normal looks like. And so we've been kind of coming back to our core leaders saying, here's the important skills you need as a core leader. Let's not focus on how to recruit someone or how to hire someone. Let's really talk about your deep skills and how you lead. And so we're really focused on that for the next year, on really educating or re-educating our core leaders on what their jobs really are.
So
I would say from a mental health resource, and when you talk about retention, I'm really proud of the resources that we put into place for our caregivers. I've loved the fact that we talk about mental health in almost every newsletter, and what the resources are out there, same day access to mental health resources, stress tactics, assessments. I really love what our well-being team has put together for people. And I do believe that that does help our overall retention when it comes to critical incidents, and we have the support there to get our caregivers to the next step.
Okay.
Go
ahead, Suzie.
I was going to say, if I could jump in one more time, there was a question in the chat that applies to both the retention and the recruiting strategies that we use. And the question was, how do you structure career development to make sure everyone has that support and no one is missed? And the answer applies to career development, retention, recruiting. You have to apply multiple techniques and multiple strategies so that you can meet your caregivers where they are. Not everyone is going to want that online experience. Some people want that face-to-face. Even with our managers and the leader development, some of it we are applying online because that meets the needs of some. Others want that in-person sessions where they can talk to one another. So it's really tailoring it to the needs of individuals and meeting them where they are.
Yep. Okay. What I'd love to do next is just share a little bit more about Incredible Health, and then specifically about the work Incredible Health and Providence Swedish and Providence St. Joseph overall do together. I have some permission from your awesome HR leaders and talent acquisition leaders, including Rob Dick, who's on the line, to share a little bit of information about and a little bit of data about our results as well. So, and then I'll also afterwards just come back to more questions. There's a few questions that have come in from the audience, and then plus want to just go a little bit deeper on the topic of scheduling and training for nurses too. So Incredible Health, we're a software company based in San Francisco. We operate nationally, and hospitals, they use our custom matching algorithms to hire high quality permanent nurses in less than 20 days. We're used by over 700 hospitals and health systems across the country, including very large systems like HCA and Tenet, as well as Providence St. Joseph and Kaiser Permanente. We also work with many community hospitals too, that are much smaller than some of these organizations, as well as academic medical centers like Johns Hopkins, Cedars-Sinai, and USC, and others. So as far as what it is that we do, that our claim to fame is that the employers apply to the nurses instead of the other way around. And so we really flipped it around because, and as you can imagine, the nurses love it. You know, the nurses create a profile, they sit back and relax, they get interview requests from, say, they're in the Washington, they want something in the Washington market, they're getting interview requests from Providence St. Joseph, from Kaiser Permanente, from, you know, Adventist Health, et cetera. And they're able, and they're able to choose, the nurse is able to choose which interviews to accept or decline. We've also embedded proprietary screening and matching. So the talent is, the nurses are pre-screened and pre-matched before they're put in front of Providence St. Joseph's talent acquisition teams. And then there's also a robust set of data analytics that helps HR leaders and nursing leaders identify any bottlenecks. They can compare themselves to their local competition nationally as well, just anonymously, of course, just to further identify additional improvement areas, and also to celebrate successes too. So as far as what we do for nurses, you know, the key for us is we provide a whole free range of tools and services to nurses in our apps. They get access to free continuing education accredited in all 50 states. They have access to salary estimators. They get access to career coaches. We have an exclusive social network for nurses in our apps where they can ask each other for advice. And all of these are completely for free. So nurses can join our community. That is why we have over 800,000 US nurses. So 1 in 4 US nurses is on the platform. And then a portion of those nurses also use our hiring marketplace as well. And the entire platform is just for permanent workers. This is certainly not the marketplace for temporary labor. We form long-term relationships with the hospitals that we work with to continue supporting permanent nurse hiring. I shared a little bit of this data earlier. 68% of the nurses on the platform accept the very first offer they receive, and 61% accept the very first offer, even if the second or third offer has higher compensation. And that really speaks to the importance of speed in the hiring process, which you know, you've heard Suzie and Dana implement a very key program that accelerated speed. That helps. It helps a lot. And it is probably the biggest factor in any market. Is speed of hiring. Suzie and Dana, you do operate in a very competitive market. You have University of Washington there, you have Kaiser Permanente there, and many other health systems. So you know, nursing and HR leaders really have to work hard to improve speed and implement key programs that'll enable speed in order to compete in such a competitive market. This is just data from another health system. This is a health system in the LA area where we were able to reduce the days to fill from 66 days down to 19 days. Where we had the biggest impact was on time to source, where we were able to bring that down from 44 days down to 3 days. We do reduce days in other parts of the process just through automatic interview scheduling and doing that pre-screening and pre-matching, of course. But the idea here is by hiring permanent nurses faster, we want to help the health systems reduce temporary labor. And I'm sure Suzie and Dana, you're probably under a lot of pressure to keep bringing your premium labor and your temporary labor costs down. They're both nodding. Okay. So we also monitor retention. So when nurses are hired through the Incredible Health platform, their retention is usually on average 15% higher than the hospital's baseline. The reason for that is the nurses was able to consider multiple opportunities before, you know, going with Providence Swedish. And it's a very well thought out job search process as opposed to just taking the first thing I can get. This is in general how our two teams work together. So everyone roughly has the same 8 steps in the hiring process, from sourcing to making sure they're qualified, making sure they're actively looking, getting phone screens completing, getting manager interviews completed, getting offers out and getting them accepted. So this is a true collaboration. It's a true partnership. It requires both parties to drive the success here. Incredible Health does a lot of the heavy lifting in the first 4 steps. We're sourcing, we're pre-screening, making sure the talent is actively looking. At that point, the Providence team is taking over. The talent acquisition team is completing phone screens. And then they're working with the nursing leaders to complete hiring manager interviews, get offers out, and getting offers accepted. This is a newer model in talent acquisition where, you know, we talk a lot about nurses operating at the top of their skill set. We also need our recruiters to work at the top of their skill set too, which is engaging with talent and building relationships with their hiring managers. And some of these other steps that are earlier in the process can be automated with things like Incredible Health. Finally, just want to share some results of our partnership. There's been over 70 nurses hired just for Providence Swedish in particular through Incredible Health. They average about 8 years of experience on average in 2023. And we brought the days to fill down from 65 days down to 28 days is the average right now for nurses hired through Incredible Health. And that's been tons of effort from your talent acquisition leaders and your nursing leaders to keep bringing that days to fill down. The return on investment has been almost $5 million. The way we calculate that is by hiring permanent nurses faster. We want to reduce your temporary labor costs. So this $4.9 million in savings is from a reduction of premium nurse labor. Over 30% of the nurses hired have over 10 years of experience, and some of the top specialties that have been hired have been in the emergency room, critical care, and med-surg. So I will pause there and turn to some Q&A. There were a couple of questions that were already submitted. There was sort of a general question just around the topic of scheduling. Curious, Suzie, what is your philosophy on scheduling for nurses? You know, there's a more and more desire from the market to have more flexible schedules. So how are you thinking about that challenge?
Oh, thank you for that question. We've actually been doing self-scheduling here within our ministries for a number of years, which in and of itself, I think facilitates the desires of our nurses to meet their needs in addition to filling shifts. The other thing is our caregivers have the opportunity to hire into either a full-time position or part-time positions. And for some of our full-time nurses, if they want to transition into part-time, we allow them the flexibility to be able to work within that and move from full-time to part-time if we've got open positions available for them to shift into. We've recently opened up some weekend-only shifts because we had caregivers tell us, hey, I want to be with my family during the week, but I also want to work. So to allow that flexibility, we opened up weekend-only shifts. So we're really engaging with our caregivers to hear them and meet them with where they are in terms of what shift lengths they want, what type of work they want to do, and then be able to build our schedules around that.
And then you allow self-scheduling too, is that right?
We do. Okay,
fantastic. And then another question that was submitted is this is a question from Doris that came in. Does the hiring leader, this is back to the peer program, does the hiring leader keep in touch with the candidates as they're moving through the onboarding phase and the pre-boarding phase? Or is that something that the HR team tackles? How have you divided that?
You want me to take that, Suzie? So what we do, once that peer leader makes that hire, we hand it over to that hiring manager or to the core leader that will be overseeing them to have them start to build a relationship with that new caregiver. We also have the coordinator kind of keeping, or AKA the closer, keeping in contact, removing any barriers, making sure that they're moving through that process as seamlessly as possible. But we really use this time to start building that relationship between the caregiver and that core leader.
Great. Suzie, you highlighted many training programs earlier, including the one for student nurses. How are you just thinking strategically about sort of expanding training or investing more into training for nurses?
Yeah, so we've really focused on, from a strategic perspective, looking at it both from the workforce that we need in the future, and recognizing that we need to build both our registered nurse workforce and the support staff. So we have partnered with our local colleges and universities to be able to ensure that we've got the nurse tech program, that we've got preceptorships available for the colleges and universities to bring their students in through that, and that we've got scholarships for those students who may not otherwise be able to afford the education. So we're helping facilitate that. And then we're also looking at the support structure by building programs, the surgical tech program, the student nurse assistant program. We've also got a pharmacy training program to get pharmacy tech. So if you can think of a discipline, we're working and thinking ahead to be able to coordinate how can we help our community facilitate their education so that they can then help our community in the care of our patients.
Okay, so one of the sometimes some of the challenges leaders run into is just building the business case for training programs, and the sort of the ROI, because they're not heavy investments, but they're there's still some costs associated with them. Is your business case primarily just around improvement of retention and improvement of hiring, or how do you think about the sort of the ROI of these programs?
We have really focused our ROI on the retention component. If we're bringing in a student and investing in their education, we are then hoping, hope's probably not strong enough of a word, we're anticipating that they're going to stay with us and be invested in us and continue their professional career with us, as opposed to just coming for that short-term education. And that's really what we're seeing too. The majority of our student nurse techs upon graduation are staying with us for a residency. Those that have departed have generally gone to either another Providence ministry in a different area, or have left the state for other reasons, but otherwise would have stayed as we talked to them upon exit.
Okay. By the way, if we don't get to everyone's questions, please feel free to email us at questions@incrediblehealth.com. This webinar is recorded, and a member of the Incredible Health team will be in touch to share the recording too. Here's my final question for both of you. Look, this is obviously a very challenging problem and challenging time for nurse hiring and for nurse retention. But it's also a very hopeful time. There's an enormous amount of attention on the nursing workforce. Part of that's been the silver lining of the COVID-19 pandemic. There's like mainstream attention on the nursing workforce now. And so it's also really elevated the profile of nursing, even within our organizations, right? And there's more and more willingness to invest in changes and programs and so on for nursing. I guess from your standpoint, what would be your top 3 tips for your counterparts in other parts of the country? So for the other nursing and HR leaders who are in the same position as you, trying to move things forward, what are your top pieces of advice?
Dana, would you like to start, or would you want me to?
Oh, I can go ahead, Susie. My top 3, wow, build a strong relationship. If you are in HR or you're a CNO, build a strong relationship together. I have a CNO blessedly right now that does not say no, that is innovative, and we want to get there, and we try to come together to create solutions that are innovative and courageous and new. And Susie never says no, but you need to build that strategic and trust between your partners. So my CNO, and then Rob's out there, my talent acquisition partner from an HR perspective, we probably talk almost every day. If not, we should have. And so build that relationship, build that partnership, and make sure that you're communicating and understand each other's objectives. So get out of email. Get out of IM and have those conversations about your strategic goals and build that relationship.
And I would just add, engagement's key. You have to listen and respond to the signs of the times so that we can meet the needs of our current workforce and those that want to join us. Those relationships, as Dana said, that's the key. Figure out a way to get to yes through those relationships that you're developing with those partners.
Yeah, I'm not allowed to tell Suzie no. So
Awesome. Thank you so much. Thank you both for your time and for sharing your tips and your advice and your strategies and your tactics. This is a very challenging problem. And so we really appreciate you sharing your insights with all of us. And just thank you so much. Thank you both for your time.
Thank you.
thank you.
All right. Thanks, everybody.